Hi everyone, welcome to our first edition of Focus on Primary Care. The goal is to get more information out to our team and providers, and today we're going to be speaking with Tiffany Bengston from the Patient Panel Management Team. Hi Tiffany.
Hello.
Thank you for doing this.
Sure.
So I wanted to start out, some people know more and some people know less about the Patient Panel Management Team that really is instrumental and so supportive of us in scheduling our annual wellness visits. So we have the goal of reaching 85% of our patients that are due for annual wellness visit, and your team is so crucial to that. Can you just review for me a little bit of the process that your team goes through trying to achieve these goals?
Sure. First, we receive the information regarding the patient from the insurance company, so the panels. Then we spend time reviewing each patient's eligibility for annual wellness visits. Then we outreach to the patients, and then we schedule the visit. After the visit has been completed, we spend time reviewing the chart notes to make sure that the correct coding was captured. And then if not, then we continue to outreach and reschedule that patient.
Wow, that sounds like a lot of work, and your team really follows it from beginning to end. Yes. So I know recently that you provided the physicians with some individual information about their panels, and the goal of this again is to help us reach our 85% goal that we have individually. Can you tell me a little bit about that information that you're sending, and how do you think we can use it as a tool to help us reach our goals?
Sure, yeah. This information was captured for the quarter, Q1, and it captured information on visits that have been completed up to the point of the report, not information from claims, and also not capturing visits that were scheduled at the time. And the goal is to provide information for the provider to utilize that to understand how many visits they may need to complete per week to get the 85% by the end of the year.
So is it true then that the number that we are seeing in this email is the number of annual wellness visits that have already been performed or done at that time? It may not include if there were some that were completed in the last week or so, but as of the time of your reporting, what it's giving is annual wellness visits completed. Now, when you say it doesn't include claims information, is there some annual wellness visits done that we may not capture, or what difference does that make?
The difference is the information from the insurance companies on annual wellness visits that have been completed has a lag time, so it doesn't show up for a couple of months after they've been completed. So usually the information from claims is more relevant at the end of the year.
Okay, so your team has the really up-to-date information, again, up-to-date as of the running of the report, right? Okay. And is there anything else that you would like to tell us about the Patient Panel Management Team's process?
Yes, absolutely. We spent a great deal of time reviewing patient eligibility for annual wellness visits, looking into insurance and when their last visit was, even outreaching to them to find out if things have changed with their insurance. And that really allows us to guarantee almost that every annual wellness visit that we schedule, whether it's a physical and annual wellness visit or just an annual wellness visit, is correctly scheduled. We do also have a system in place to review annual wellness visits and physicals that may have been scheduled by team members outside of the patient panel management team.
Wow, so we can be assured if we see annual wellness visit type listed, whether your team has scheduled it or someone else, that it's been reviewed and is an accurate. It's an annual wellness visit that's due. I know it gets so confusing sometimes. Even myself, I'll remember for a while and then I forget, which ones are 365 days, which ones can you do a physical with. Can you talk a little bit about that? I know that, most of us have this guide that you presented to us, and some of us have the laminated bigger version. But can you simplify that for us a little bit, or tell us, just review it quickly?
Sure. So the easiest way that helps me to remember it is Aetna Medicare Advantage is very similar to fee-for-service in the fact that the annual wellness visits must be 12 months apart. So we know that Medicare fee-for-service does not pay for a traditional physical. Aetna Medicare Advantage does pay for an annual physical. Then we have Premera.
Okay, so if I can stop you right there. The annual wellness visit then for fee-for-service and Aetna is only covered every 12 months, is that
Correct.
right? And I think we all know we can't do physicals for fee-for-service Medicare, but for Aetna we can do a physical.
Correct.
Is there a time frame on that, or tell me it cannot be done with an annual wellness
Correct.
visit,
It
is
cannot
that
be
right?
done. Correct.
Yes, and their physicals are, is there a time frame on the Aetna physicals?
12 months.
12 months, okay. So both Medicare fee-for-service and Aetna, you can do annual wellness visits only every 12 months.
Mhm.
And for Aetna, you can do a physical, not with the annual wellness visit, and it's every 12 months,
Yep.
right?
Mhm.
Okay, so tell me about some of the other insurances.
Premera Medicare Advantage changed this year so that annual wellness visits must be 12 months apart.
Okay.
The physicals must be 12 months apart,
Okay,
and the annual wellness visits can be any time during the year.
so that's Premera
Medicare Advantage.
Medicare Advantage. You can do the annual wellness visit any time of the year.
Mhm.
So we don't need to see that and think, well, it hasn't been 365 days. If it's Premera and you've scheduled it, it can be done. But their physical
Mhm.
can only be done every 12 months, is
Yep.
what you're telling me.
Exactly.
And they cannot be done
Cannot be done together.
together. Okay, so far we've got either no physical or can't do the physical with the annual wellness visit, no physical with Medicare fee-for-service. And then there's the other group.
Yep, we have
Yeah.
Humana, United Healthcare, and Regence Medicare Advantage.
Okay, those three Medicare Advantage plans,
Mhm.
Humana, Regence,
And United
and
Healthcare.
United Healthcare.
Mhm.
Okay, that's who we're talking about.
And those are, they allow annual wellness visits and physicals to be completed together, and they can be done any time during the year.
Okay, so for those three plans, you can do it any time of the year and you can combine it with a physical.
Correct.
Okay,
Mhm.
great. Well, I'll remember that until at least tomorrow, but I've got this guide, right? Okay, that's great. Okay. My last question for you, I promise, and then we're going to open it up to the group for any live questions. So, thank you for all the information, and thanks for all that your team does in supporting us.
Mhm.
Is there any ways that you can think of that we could better support you? Or is there any blocks to your work? Just anything that you'd like to share with me to educate the providers?
Sure, thank you. One thing that would really help us get the annual wellness visits scheduled is for the providers to help promote and educate their patients on how important annual wellness visits are and the value that they have to the patients. As we've experienced, some patients believe that the annual wellness visits may not be a necessary visit and might be not valuable, but that's not the case.
Okay, so just in supporting these visits and the which are designed, of course, to identify risk factors and get the patient any early help and support that they need. Just supporting these visits overall.
Correct.
Yeah. Anything else, Tiffany?
No, thanks for having me.
Yeah, wonderful. Thanks for going over this again. We appreciate it.
No problem.